significantly increasing their risk of heart disease. This silent buildup in your arteries can lead to serious complications if left unchecked. In this video, we're going to explore 5 effective strategies to prevent calcium buildup in your arteries. You'll learn about the crucial lifestyle changes and medical tests that can protect your heart and keep it healthy. By understanding and applying these methods, you can significantly lower your risk of heart disease and enjoy a healthier life. If you find this information valuable, please give us a thumbs up, subscribe to Combat Heart Disease and hit the bell icon to stay updated with our latest heart health tips. And don't forget to watch until the end to learn how to get 2 exclusive heart health gifts that we guarantee you and your heart will love. Let's get started. Number 5. Heart-healthy diet. Eating right is crucial for keeping your heart and its arteries in top shape, helping you avoid calcium buildup. A diet rich in fruits, vegetables, whole grains, lean meats, and fish ensures your coronary arteries, essential for supplying blood to your heart, stay healthy and clear. Research shows that people who consume high amounts of omega-3 fatty acids found in fish like salmon and mackerel have fewer calcium deposits in their arteries. The American Heart Association recommends these foods to keep blood flowing smoothly and reduce the risk of arterial calcification. Antioxidant-rich berries such as blueberries, strawberries, and raspberries help fight inflammation. Omega-3-packed fish like salmon, mackerel, and sardines are excellent choices. Finally, soluble fiber sources like nuts, seeds, olive oil, whole grains, and legumes help lower cholesterol levels and keep artery walls smooth. Steer clear of junk food, sugary drinks, red meat, salty snacks, and anything high in bad fats. These can accelerate calcification and increase the risk of heart problems. By carefully choosing heart-friendly foods, you can protect your arteries from clogging and ensure your cardiovascular system stays strong. Making smart dietary choices leads to better overall health and significantly lowers the risk of heart disease. Up next, we'll explore a powerful lifestyle change that enhances your heart health even further. Number 4. Regular physical activity. Regular physical activity is a fantastic way to prevent calcium from accumulating in your arteries. Incorporating exercise into your daily routine does wonders for your heart, promotes healthy blood flow, and reduces the risk of arterial hardening. Exercise helps lower high blood pressure, reduce bad cholesterol, and increase good cholesterol, HDL. This combination works together to prevent artery calcification. Additionally, physical activity strengthens the muscle cells in your arteries, making them less prone to clogging with calcium. Improve your circulation by keeping active as exercise ensures oxygen-rich blood reaches your heart without any blockages or buildup. Regular physical activity enhances the health of your arteries, keeping them flexible and clear. Studies have shown that people who are consistently active have a much lower chance of developing coronary artery calcification compared to those who lead a sedentary lifestyle. Aim for 150 minutes of moderate-intensity aerobic activity each week, such as brisk walking or cycling. Alternatively, go for 75 minutes of vigorous intensity activities like running. Incorporate strength training twice a week to build muscle and support arterial health. By making exercise a regular part of your life, you can effectively combat calcium buildup in your arteries and enhance your heart health. Next up, we'll dive into a transformative habit that not only supports your heart health, but also helps you stay fit and balanced. Number 3. Maintain a healthy weight. Maintaining a healthy weight is essential for preventing calcium buildup in your arteries, which in turn reduces your risk of heart disease. Carrying extra pounds, especially around your belly, can lead to high blood pressure, increased cholesterol levels, and insulin resistance. All these factors are closely linked to coronary artery calcification and other severe health conditions. A study published in the Journal of the American College of Cardiology found that individuals with a higher body mass index had a significantly greater risk of developing coronary artery calcification. Keeping a healthy weight reduces this risk and supports overall heart health. Some key benefits of maintaining one's healthy weight include reduced stress on heart and vessels. Excess weight puts additional stress on your heart and blood vessels, raising blood pressure and making calcium buildup more likely. It helps lower blood pressure and cholesterol. Losing weight can help bring down high blood pressure, cut cholesterol levels, and boost overall heart health, lowering the risk of coronary artery calcification. Now the question is, how do we maintain a healthy weight? You should 150 minutes of moderate intensity aerobic activity each week, paired with strength training exercises. In addition, focus on well-balanced meals rich in nutrients, avoiding quick fixes or extreme diets. Consistent, sustainable changes are more effective for long-term weight management. By maintaining a healthy weight, you not only lower the chances of calcium buildup in your arteries, but also enhance the overall efficiency of your cardiovascular system. As we delve deeper into understanding how to prevent calcium buildup in our arteries, let's address some common misconceptions and important questions. Many believe that consuming calcium-rich foods directly leads to arterial calcification. However, it's the balance of nutrients that matters. Calcium absorption relies on magnesium, vitamin D, and vitamin K2. Without these, calcium may deposit in arteries rather than bones. Chronic inflammation is another overlooked factor. Elevated inflammatory markers, such as C-reactive protein, can contribute to calcification. Poor diet, lack of exercise, and chronic stress often drive this inflammation. Medications like statins, while lowering cholesterol, may paradoxically increase calcification in some cases. Understanding the holistic picture, including nutrient balance, inflammation control, and medication effects, is essential for heart health. Up next, discover a crucial lifestyle change to protect your arteries from calcium buildup and enhance heart health. Number 2, quit smoking and limit alcohol. To keep your heart healthy and prevent calcium buildup in your arteries, it's crucial to quit smoking and limit alcohol consumption. Both habits can significantly harm your heart by contributing to coronary artery calcification, where unwanted calcium deposits accumulate in your arteries. Quitting smoking reduces inflammation and the risk of blood clots, which are precursors to calcium buildup. Smoking damages the inner walls of arteries, exacerbates inflammation, and increases the likelihood of blood clots, all of which promote calcium buildup. Quitting smoking can dramatically lower these risks. Excessive drinking raises blood pressure, disrupts heart rhythms, and increases levels of triglycerides, leading to calcium deposits. Keeping alcohol intake light, 1 drink a day for women or 2 for men, helps prevent these issues. When you quit smoking and limit your alcohol consumption, it helps lower inflammation and blood clot risks, leading to healthier arteries. It also improves blood pressure and cholesterol levels, reducing the likelihood of calcium deposits and overall heart disease. Before we unveil our number 1 way to prevent calcium buildup in arteries, let's pause for anticipation. To support you in fighting heart disease more effectively, we're thrilled to offer 2 extraordinary free gifts we've compiled just for you. First up, we're giving away our exclusive ebook, 7 Foods That Clean Arteries and Prevent Heart Attacks. this is no ordinary list. It's a treasure trove of culinary delights that are both mouth-watering and beneficial for maintaining stable blood pressure levels. And lastly, you'll gain access to a breakthrough video, the shocking cause of cardiovascular disease and what you should do starting today. This innovative approach, the ancient signaling molecule found in our ancestors, offers a potential paradigm shift in how the nectar of gods can help restore it for optimal heart health. It's a piece of knowledge too valuable to miss. To claim these incredible 2 free gifts, simply click on the link in the description below. Now, let's return to our countdown and unveil the number 1 way to prevent calcium buildup that stands as a pillar in the 5 ways to prevent calcium buildup in arteries. Number 1. Monitor blood pressure levels. Managing blood pressure is the most critical step in preventing calcium buildup in your arteries and safeguarding your cardiovascular health. High blood pressure, or hypertension, can cause significant damage to your arterial walls, increasing the risk of coronary artery disease and other serious heart conditions. By actively monitoring and controlling your blood pressure, you can greatly improve your heart health and reduce the chances of cardiovascular events. A compelling study published in the Journal of the American Medical Association found that individuals who maintain their blood pressure below 120/80 ths millimeter of mercury had a 50% lower risk of developing severe arterial calcification compared to those with higher reading. Routine checkups help detect any irregularities early and allow for timely intervention. Using home blood pressure monitors can provide more frequent readings and help you track your progress. If prescribed by your doctor, take blood pressure medications as directed. These medications can be crucial in keeping your blood pressure within a healthy range. Medical interventions work best when combined with lifestyle modifications. Follow a diet low in sodium and rich in potassium. Incorporate fruits, vegetables, and nuts. Whole grains and lean proteins to support heart health. Engage in at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity exercise each week. Include strength training exercises twice a week for optimal benefits. Practice relaxation techniques such as meditation, yoga, or deep breathing exercises to manage stress effectively. Ensure you get 7 to 9 hours of quality sleep per night. As poor sleep can negatively impact blood pressure, keep alcohol intake to moderate levels. No more than 1 drink per day for women and 2 drinks per day for men. Taking these proactive steps to manage your blood pressure will not only protect your heart, but also contribute to your overall well-being and longevity. Prevention is key to maintaining cardiovascular health, highlighting the importance of keeping blood pressure within a healthy range. So there you have it. 5 powerful strategies to prevent calcium buildup in your arteries. Embracing a heart-healthy diet, engaging in regular physical activity, maintaining a healthy weight, quitting smoking and limiting alcohol, and closely monitoring and managing your blood pressure. By incorporating these practices into your daily routine, you can significantly reduce your risk of arterial calcification and heart disease. Opt for a balanced diet, stay active, keep your weight in check, avoid smoking, and regularly monitor your blood pressure. Each step you take is a step towards a healthier heart and a longer life. Now we'd love to hear from you. What steps are you taking to improve your heart health? Do you have any additional tips that have worked for you? Share your thoughts in the comments below. Your insights can inspire and help others on their journey to better heart health. If this video has provided valuable insights into protecting your heart, please hit the like button, subscribe to Combat Heart Disease, and click the bell icon for more helpful tips. And if you want to show extra support, consider using the Super Thanks feature. Your support helps us continue to provide valuable health insights. Before you go, don't forget to check the description below for links to your 2 free heart health gifts. These resources are packed with valuable information to help you maintain optimal heart health. Remember, your heart health is in your hands. Thank you for watching, and until next time, here's to a healthier, happier you. Every year, thousands of lives could be saved if people knew the early signs of a heart attack. Are you aware of the subtle warnings your body might be giving you right now? In this video, we're uncovering the 6 crucial signs of a heart attack that can manifest a month before it happens. Understanding these symptoms is vital. They can make the difference between life and death by enabling timely medical intervention. If you stay until the end, I'll reveal to you the most overlooked sign that could save your life. Before we dive into these crucial signs, please help us spread this life-saving information by hitting the thumbs up. Your support helps us reach more people with these vital health tips. If you're new here, subscribe to Combat Heart Disease and click the bell icon to stay updated with our latest videos. We regularly share important content to help you maintain a healthy heart. Plus, watch till the end to find out how to get 2 heart health free gifts. These resources are designed to provide you with valuable information to keep your heart in top condition. Let's get started. Number 6. Unusual fatigue. Unusual fatigue, where rest doesn't seem to help, can be a subtle but critical warning sign of a heart attack. This persistent tiredness might indicate that your heart is struggling to pump blood efficiently. Often overlooked or attributed to other causes, this kind of fatigue can be the body's way of signaling potential cardiovascular distress. A study found that women especially report severe fatigue up to a month before a heart attack. This isn't just feeling tired after a long day. It's an overwhelming fatigue that affects your daily life and doesn't improve with rest. Early detection and intervention are vital in preventing a heart attack. Maintaining a healthy lifestyle through a balanced diet and regular exercise, managing stress levels, and avoiding smoking can all contribute to better heart health. Remember, prioritizing your heart health and being aware of these warning signs can potentially save your life. Up next, we'll explore a symptom that might seem ordinary, but can be a significant early indicator of heart trouble. Number 5. Shortness of breath. Experiencing unexplained shortness of breath, even during light activities or while at rest, can be an alarming early sign of a heart attack. This symptom, characterized by feelings of breathlessness or difficulty breathing, can manifest up to a month before a cardiac event, signaling that something is wrong with your heart's ability to pump blood efficiently. Shortness of breath can often precede a heart attack by weeks. This happens because when the heart struggles to pump enough blood, fluid can build up in the lungs, making it hard to breathe. It's a phenomenon that not many people associate with heart health, but it's a crucial indicator. Did you know that people with persistent shortness of breath are more likely to develop severe heart conditions? This symptom is often a precursor to heart failure, where the heart cannot meet the body's demands for blood and oxygen. This lack of oxygenated blood flow can cause fluid to accumulate in the lungs, which can we'll delve into a symptom that might make you think of indigestion, but could be an early warning of something much more serious. Number 4. Chest discomfort. Chest discomfort is one of the most critical warning signs of a heart attack and should never be ignored. This discomfort often presents as pain, pressure, tightness, or aching in the chest and can vary in intensity from mild to severe. It is typically caused by reduced blood flow to the heart muscle due to blockages or narrowing of the coronary arteries. which are responsible for supplying oxygen and vital nutrients to the heart. This restriction in blood flow leads to an inadequate oxygen supply, triggering chest pain or discomfort. The heart relies on a steady supply of oxygen-rich blood to function effectively. When the coronary arteries become narrowed or blocked by plaque, a buildup of fatty deposits, the flow of blood is restricted. This condition, known as coronary artery disease, can cause angina, which is the medical term for chest pain or discomfort due to reduced blood flow to the heart. Nearly 50% of people experiencing a heart attack report some form of chest discomfort. This discomfort can last for several minutes or come and go. Even mild chest pain can be a sign of a serious problem. Interestingly, chest discomfort related to heart issues often occurs during physical exertion or emotional stress, and it can sometimes be mistaken for indigestion. As we explore the critical warning signs of a heart attack, it's essential to understand the underlying reasons for the increasing prevalence of heart issues among younger populations. Modern lifestyle choices play a significant role, but there's more to the story. Despite medical advancements and increased awareness, heart attacks are on the rise. Especially among people under 40, why is this happening? The answer might shock you. The hidden enemy lies in our everyday habits. From the convenience of fast food to the sedentary lifestyle encouraged by our digital age, these factors contribute silently, yet significantly, to the deterioration of our cardiovascular health. But there's another layer to this issue. One that's rarely discussed but equally critical. Could there be environmental or genetic factors at play that we haven't fully understood yet? Up next, we'll delve deeper into the subtle but vital signs that often go unnoticed. One of these signs might be something you're experiencing right now, without even realizing it. Number 3. Frequent indigestion. Frequent indigestion can serve as an early indicator of an impending heart attack, potentially occurring as early as a month before the cardiac event. Indigestion typically manifests as discomfort or pain in the upper abdomen, often accompanied by a burning sensation or a feeling of fullness. This might seem like a minor inconvenience, but its underlying cause can be much more serious. When the heart's blood supply is compromised due to narrowing or blockages in the coronary arteries, it can affect other parts of the body, including the digestive system. The reduced blood flow can lead to inadequate oxygen and nutrient supply to the digestive organs, causing symptoms like indigestion. It's important to note that indigestion related to heart problems often doesn't improve with typical over-the-counter remedies. This persistent discomfort can be a warning sign that your heart isn't getting the blood flow it needs to function properly. Understanding this connection can help you recognize indigestion as more than just a digestive issue, but a potential signal of a heart attack. Next, we'll delve into a symptom that can disrupt your cycle and might be more telling about your heart health than you realize. Number 2, sleep disturbances. Sleep disturbances can often serve as an early indicator of an impending heart attack, potentially occurring up to a month before the event. These disruptions in sleep patterns may present as challenges in falling asleep, you staying asleep, or waking up abruptly during the night. The connection between sleep and heart health is profound, with both the quality and duration of sleep playing a crucial role in maintaining overall cardiovascular well-being. People who experience frequent sleep disturbances are more likely to develop heart disease. For instance, insomnia has been linked to a 27% higher risk of heart attack. Poor sleep quality can affect the body's ability to repair and rejuvenate, leading to increased stress on the heart. Moreover, sleep apnea, a condition where breathing repeatedly stops and starts during sleep, has been found to double the risk of heart attack. This condition can cause sudden drops in blood oxygen levels, which strain the cardiovascular system. Such disturbances can lead to elevated blood pressure and other cardiac stressors, contributing to the risk of a heart attack. Understanding the critical link between sleep and heart health underscores the importance of maintaining healthy sleep habits. Ensuring you get enough restorative sleep can be a key factor in preventing heart issues. Before we reveal our top sign, we want to support you in fighting heart disease more effectively. We're thrilled to offer you 2 extraordinary free gifts we've compiled just for you. First, we're giving away our exclusive e-book, 7 Foods That Clean Arteries and Prevent Heart Attacks. This comprehensive guide will help you make heart-healthy choices with delicious and nutritious foods that can improve your cardiovascular health. Next, you'll gain access to a breakthrough video, The Shocking Cause of Cardiovascular Disease, and What You Should Do, starting today. This eye-opening video will provide you with actionable steps to protect your heart and enhance your overall well-being. To claim these incredible free gifts, simply click on the link in the description below. These resources are packed with valuable information and practical tips to help you take control of your heart health. Now, let's return to our countdown and unveil the number 1 sign that stands as a pillar in the 6 signs of heart attack a month before. Number 1. Excessive sweating. Excessive sweating, particularly cold sweats, can be a crucial early indicator of a heart attack that may occur up to a month before the actual event. Cold sweats manifest as sudden and unexplained sweating, often accompanied by a feeling of clamminess or dampness. Unlike regular sweating, cold sweats can occur without physical exertion or an increase in body temperature, making them an alarming sign to watch out for. During a heart attack, the body's autonomic nervous system reacts to the decreased blood flow and oxygen levels by stimulating the sweat glands. This response can lead to profuse sweating as the body tries to maintain a steady core temperature despite the reduced oxygen supply to the heart. Interestingly, a study published in the journal Circulation found that over 40% of heart attack patients reported experiencing unusual sweating as an early symptom. This underscores the importance of recognizing cold sweats as a potential warning sign. It's not just about feeling warm, it's about your body reacting to serious stress due to impaired heart function. If you notice cold sweats or experience a sudden and unexplained rise in sweating, it's a signal that something may be wrong. This type of sweating often appears at rest or during minimal activity, indicating your heart might be struggling to pump blood effectively. Understanding the significance of cold sweats and taking them seriously can be life-saving. It's a subtle yet powerful signal from your body that shouldn't be ignored. So there you have it. The 6 signs that could indicate a heart attack up to a month before it happens. Unusual fatigue, shortness of breath, chest discomfort, frequent indigestion, sleep disturbances, and excessive sweating. We'd love to hear from you. Which of these signs surprised you the most? Do you have any other symptoms we didn't cover? Sharing your story below could provide insights and encouragement to others navigating similar paths. If this video has provided you with valuable insights or reinforced your current health strategies, please show your support by hitting the like button and subscribing to Combat Heart Disease and clicking the bell icon so you get instant notifications whenever we upload new videos. Your support helps us reach more people with these life-saving tips. The Super Thanks feature is also a great way to help us continue providing valuable health insights. Before you go, don't forget to check out the exclusive free gift links in the description below. They are packed with valuable information and tools to help you manage your heart health more effectively. Remember, where your health is in your hands. Thank you for watching. Stay vigilant, stay informed, and here's to your heart health and overall well-being. Welcome to today's video about 10 warning stroke signs in women. Did you know every 40 seconds, someone in the US suffers a stroke? But there's one group at even greater risk: women. What if recognizing a subtle change could be the difference between life and death? In this video, we dive deep into the 10 crucial warning signs of stroke in women. Understanding these signs isn't just informative, it could be life-saving. We'll also delve into preventative measures and treatment strategies, empowering you with the knowledge to protect yourself and your loved ones. But before we dig in, can you do us a favor? Help us spread this life-saving message by hitting the thumbs up. And if you're new here, don't forget to subscribe to Combat Heart Disease and click the bell icon so you never miss out on our new videos. And stick around to find out how to get 2 heart health free gifts. We guarantee both you and your heart will love them. Let's begin our countdown starting at number 10. Number 10. Sudden numbness or weakness of the face. People often say, time is money. But talk to any neurologist and they'll tell you time is brain, because when it comes to strokes, every minute counts. Stroke is the 5th leading cause of death in women, according to the U.S. Centers for Disease Control and Prevention. Sudden numbness or weakness in the face, arm, or leg on one side isn't just a sign of aging or fatigue. It's often a silent alarm for a stroke. This condition results from the disruption of blood flow in the brain, affecting areas that regulate muscle control and sensation, particularly in women, where hormonal variations can exacerbate vascular conditions. To quickly assess for sudden weakness, perform the smile test by smiling and checking for symmetry. Additionally, conduct the arm test by lifting both arms to see if one arm drifts downward. If you detect signs of sudden weakness through these tests, it is imperative to seek emergency medical care immediately. A quick response can drastically affect the outcome by reducing the risk of permanent damage. Up next, we delve into another stroke sign that often goes unrecognized. Number 9. Mental confusion and trouble speaking. One of the most critical yet overlooked signs of a stroke is sudden mental confusion or difficulty with speech and comprehension. This symptom is a direct result of impaired blood flow to the brain areas governing language and understanding. Research shows that women often fare better at correctly identifying the signs of a stroke. A 2003 study found that 90% of women, compared to 85% of men, knew that trouble speaking or sudden confusion are signs of stroke. During a stroke, the brain's language areas, such as Broca's and Wernicke's areas, may be compromised. This disruption can manifest as aphasia. Unlike common stroke portrayals, where symptoms are overt and dramatic, women might experience subtler signs. They might suddenly find it hard to follow conversations, or feel words slipping away, just as they're about to speak. This confusion isn't just about forgetting a word, it's as if the usual pathways of thought and speech are momentarily scrambled. To quickly assess someone for this stroke sign, ask them to repeat a simple sentence like, "The sky is blue." Difficulty in articulation. Finding words or understanding the task can be a potent warning of stroke. Up next, we delve deeper into the less obvious yet equally alarming signs your body might be signaling an emergency. How well do you know your body's warnings? Number 8. Vision problems. Vision disturbances can be some of the first indicators of a stroke. These issues might include sudden blurred or double vision, or even a complete loss of sight in one or both eyes, signaling urgent medical attention is needed. During a stroke, if blood flow is interrupted to the parts of the brain that control vision, the occipital lobe, or the visual pathways, this can lead to immediate visual impairments, Symptoms might manifest as a sudden curtain-like loss of vision, blurring, or an unusual doubling of everything in view. To test for stroke-related vision issues, cover one eye at a time and notice any changes or loss in your field of vision. This can help identify subtle changes that might otherwise go unnoticed until they become more severe. If you or someone around you experiences sudden changes in vision, such as difficulty focusing, seeing spots, or abrupt vision loss, it's imperative to treat these as stroke symptoms. Coming up next, we explore another unexpected sign that could mean your brain is in jeopardy. Are you aware of how your body's balance and coordination could tip you off to a serious health threat? Let's find out. Number 7. Dizziness or loss of balance. Sudden onset of dizziness or loss of balance are not just alarming, they can severely disrupt one's ability to perform everyday tasks. These symptoms occur when a stroke impacts the cerebellum or the brainstem, areas responsible for balance, coordination, and spatial orientation. Disruption in these areas can lead to severe physical disorientation and might manifest as suddenly tripping or having trouble with stairs. Dizziness could feel like the room is spinning, making it hard to maintain your orientation. Loss of balance might make standing still or sitting upright challenging without support. A quick self-assessment can be telling. Try standing on one foot or walking in a straight line. If these simple tasks are unusually difficult, it could be a sign of stroke-related impairments. Recognizing these signs quickly is not just about identifying a stroke. It's about preventing severe falls or injuries resulting from these symptoms. While dizziness and balance issues clearly signal a possible stroke, there's more to strokes than just these overt symptoms. What other silent indicators might you be missing? Let's explore further. Number 6. Severe headache with no known cause. A severe headache that appears without any apparent reason can be more than just painful. It may signal a cerebral hemorrhage, a form of stroke, where bleeding occurs within the brain. During a cerebral hemorrhage, blood from a ruptured vessel begins to pool within the skull, increasing pressure dramatically. This pressure is what causes the intense headache, signaling that brain tissues are at imminent risk. This sudden increase in pressure can cause excruciating pain, which is often described by patients as thunderclap. Severe, debilitating, and instant. Unlike migraines or tension headaches that develop gradually, these headaches reach peak intensity in seconds and may be accompanied by nausea or even a loss of consciousness. If you or someone else experiences a sudden severe headache, especially one that feels explosively different from normal headaches, it's imperative to seek medical attention immediately. Up next, we unveil a common experience that could indicate a serious issue. Do you know how your body reacts when balance is compromised? Let's find out. Number 5. Sudden trouble with walking. A sudden difficulty in walking isn't just a sign of clumsiness. It could be signaling a stroke. This symptom indicates that the stroke may be affecting parts of the brain that govern motor and spatial orientation. A stroke impacting this area disrupts its function, leading to abrupt difficulties in walking. Signs to watch for include an unsteady gait, a sudden need to grasp onto objects for support, or a feeling of the room spinning, vertigo. These symptoms can cause a person to stumble, have difficulty standing up straight, or a sudden fall without apparent cause. Recognizing the serious nature of these symptoms is vital. When the brain's ability to coordinate movements is impaired, immediate intervention is critical to prevent long-term disability. Now that we've covered how strokes can disrupt walking, let's delve into another subtle yet serious symptom that is a major red flag for strokes in women. 4. Unexplained fatigue. Unexplained fatigue, characterized by an overwhelming and sudden weariness, can be an elusive but critical sign of a stroke in women. This isn't just ordinary tiredness. It's a profound exhaustion that appears without a clear cause and doesn't improve with rest. This symptom arises when a stroke affects parts of the brain involved with energy regulation and alertness. The sudden onset of fatigue is due to the disruption in how the brain communicates with the body to manage energy levels, often leaving individuals feeling inexplicably drained. This doesn't mean every woman should fear for her life every time they feel unexplained fatigue. The symptoms become cause for concern when they are severe enough to impair your functionality. Like feeling so weak and tired, you are physically unable to get out of bed. While fatigue might slow you down, another stroke sign could alter your behavioral and emotional state without warning. Stay tuned as we delve into sudden changes in behavior or confusion, and why they demand immediate attention. Up next, we delve into another critical indicator that could point to a serious health issue. 3. Face drooping or an asymmetrical smile. Face drooping or an asymmetrical smile is not just a cosmetic concern, but a serious medical warning sign. When a stroke occurs, the brain's motor cortex can become compromised, specifically affecting the areas that control facial muscles. This leads to one-sided facial weakness, presenting as a droop or an inability to smile symmetrically. Such symptoms are often among the first signs of a stroke, arising abruptly and sometimes resolving just as quickly, which can lead to underestimating their severity. You can quickly check for face drooping using the smile test. Ask the person to smile and observe if both sides of the mouth lift equally. If one side doesn't rise as much as the other, this could be a sign of stroke. Fast diagnosis and treatment can drastically reduce the risk of long-term damage. For women, who may experience more nuanced symptoms, understanding and reacting to this sign can be a life-saving measure. Coming up next, we uncover another startling yet often overlooked indicator that can signal a stroke. Stay tuned, as what comes next could change how you respond in a crisis. Number 2. Sudden nausea or vomiting, without a clear reason. Sudden nausea or vomiting can alarmingly signal a stroke, particularly when they occur without the usual suspects like a stomach bug or food-related issues. This reaction occurs when a stroke affects the part of the brain that controls the digestive system, causing unexpected gastrointestinal symptoms. These symptoms are particularly deceptive because they don't immediately suggest a neurological event, making awareness crucial. Up next, we uncover another subtle yet serious indicator that could mean your brain is under threat. Stay alert, knowing this next sign could be vital. Before we unveil the top stroke sign, to help you take immediate action on what you've learned today, we're thrilled to offer 2 extraordinary free gifts we've compiled just for you. First up, we're giving away our exclusive ebook, 7 Foods That Clean Arteries and Prevent Heart Attacks. This is no ordinary list, it's a treasure trove of culinary delights that are both mouth-watering and beneficial for maintaining stable blood pressure levels. Lastly, you'll gain access to a breakthrough video, The Shocking Cause of Cardiovascular Disease and What You Should Do, starting today. This innovative approach, the ancient signaling molecule found in our ancestors, offers a potential paradigm shift in how the nectar of gods can help restore it for optimal heart health. It's a piece of knowledge too valuable to miss. To claim these incredible free gifts, simply click on the link in the description below. Now, let's return to our countdown and unveil the number 1 stroke sign that stands as a pillar in the 10 warning signs of stroke in women. Number 1. Brief loss of consciousness. A sudden, brief loss of consciousness, often termed syncope, can be a terrifying and critical warning sign of a stroke. This symptom occurs when the blood supply to the brain is temporarily disrupted, causing a sudden blackout or fainting episode. loss of consciousness during a stroke might happen due to a decrease in blood flow to the brain's vital areas that regulate awareness and wakefulness. This can lead to an abrupt and brief blackout, where the person might collapse or faint without warning. It's different from simply feeling lightheaded or dizzy. It's a total, though brief, loss of responsiveness. This alarming sign serves as a critical indicator that immediate medical intervention is necessary. The sudden loss of consciousness, even briefly, can signal a severe interruption in brain function that requires urgent attention to prevent further brain damage and ensure safety. As we conclude, preventing strokes involves adopting lifestyle changes and taking preventative measures. Regular health checkups are essential for monitoring blood pressure, cholesterol levels, and overall cardiovascular health. A healthy diet and regular exercise can help manage weight, lower blood pressure, and reduce the risk of stroke. So there you have it. 10 warning signs of stroke. Every woman should know that could very well save a life. From sudden numbness to trouble speaking, being aware can save a life. Unique risk factors like hormonal changes emphasize the need for tailored preventative measures. Regular health checkups, balanced diet, and exercise play key roles in reducing the risk. Knowing how to respond during a stroke emergency and using the Be Fast method can make a significant difference. Now I want to hear from you. Have you or someone you know ever encountered these symptoms? How was the situation handled? Share your stories below to help educate others on this critical topic. If this video has opened your eyes to the crucial signs of stroke in women, please show your support by hitting the like button, subscribing to Combat Heart Disease, and clicking the bell icon. And to those considering showing extra support, the Super Thanks feature is a great way to help us continue providing valuable health insights. Before you go, remember to check out the 2 exclusive free gift links in the description below. Thank you for watching, and remember, recognizing these signs on time could be life-saving. Stay informed, stay safe. Is fatty liver dangerous? How can you recognize the early and advanced symptoms of hepatic steatosis, a silent yet serious threat? What are the key signs indicating that the fat in your liver has reached concerning levels? And more importantly, what steps can you take to eliminate this fat before it becomes too late? Today, we delve into the topic of fatty liver disease, a condition that is rapidly increasing worldwide. In the 1990s, hepatic steatosis was relatively rare. Nowadays, it is far more common than you might realize, even affecting children. In the United States alone, over 30% of adults over the age of 35 are afflicted. This is not a benign condition, untreated. It can lead to liver scarring, cirrhosis, and even liver cancer. To grasp the severity of this issue, consider that hepatic steatosis is one of the leading causes of liver transplants globally. Ignoring this condition is not an option. Timely detection is crucial because the liver possesses a remarkable ability to regenerate, but only up to a certain point. By recognizing the signs and symptoms early, you can halt the disease's progression. Remarkably, you can even reverse fatty liver, restoring your liver to a healthy state. But it's not just about recognizing the symptoms. Understanding the main dietary causes of liver fat is essential. If you suspect or know you have fatty liver, avoiding certain foods entirely is imperative. I'll also share how you can naturally combat this condition through lifestyle changes. Surprisingly, some of the best remedies for fatty liver might already be in your kitchen, not in your medicine cabinet. So, let's get started. What are the 17 symptoms of fatty liver that you cannot afford to ignore? We'll explore 6 initial symptoms and 11 more severe complications, underscoring the urgent need for medical attention. First, a crucial point: hepatic steatosis is often silent. Many people discover they have fatty liver by chance during an ultrasound or a blood test conducted for another reason, where elevated liver enzymes such as AST and ALT are detected. This can be shocking, especially hepatic steatosis does not exhibit symptoms similar to other conditions like diabetes, high cholesterol, or high blood pressure. But don't despair if you've been diagnosed with this condition. In its initial phase, fatty liver disease can be completely reversed, thanks to the liver's incredible regenerative capacity. So, were you really feeling nothing at all? Let's go to the symptoms. 6 initial symptoms of fatty liver. First initial symptom: stomach pain and heartburn. A study from UFMG revealed that individuals with hepatic steatosis often experienced dyspeptic symptoms such as heartburn, burning sensations that extend from the chest to the throat, saliva, belching, and a persistent feeling of a full stomach. These symptoms occur significantly more in individuals with fatty liver, 25% compared to 12% in those without the condition. Second initial symptom: excess gas. Those suffering from hepatic steatosis frequently deal with excessive gas accumulation. Radiologists have noted that the presence of fat in the liver can contribute to this issue, sometimes even hindering the visualization of the pancreas during exams. This excess gas is likely due to changes in the intestinal flora, which directly impacts liver health. Third initial symptom: pain on the right side of the abdomen near the ribs. This discomfort is often felt in the upper right quadrant where the liver is located, manifesting as a nagging pain under the rib. The liver's increased size can press on the phrenic nerve, causing pain around the right shoulder as well. Fourth initial symptom: loss of appetite. Loss of appetite among those with fatty liver can stem from metabolic changes, liver inflammation, and hormonal imbalances. Symptoms like nausea, abdominal discomfort, and psychological impacts contribute to a reduced desire to eat. These factors, linked to impaired liver function, disrupt the regulation of hunger and overall well-being, underscoring the need for medical follow-up and proper management. Fifth initial symptom: fatigue. The liver, an essential organ, plays a crucial role in metabolizing nutrients and generating energy. However, the presence of fat in the liver can significantly impair these functions. Moreover, steatohepatitis, a condition where liver inflammation accompanies fat accumulation, can intensify feelings of tiredness. This liver dysfunction also affects hormone production, impacting mood, sleep, and overall energy levels, leading to persistent fatigue. Sixth initial symptom: nausea. Nausea in cases of fatty liver or hepatic steatosis arises from various reasons linked to impaired liver function. The liver's reduced ability to filter toxins leads to the accumulation of harmful substances in the blood, causing nausea. Additionally, excessive fat in the liver can result in inflammation, bringing about abdominal discomfort or pain accompanied by nausea. Liver dysfunction also impacts digestion, particularly bile production, which is essential for fat digestion. Finally, liver enlargement can press on the stomach and other organs, creating a sensation of fullness and nausea. These symptoms reflect an inadequately functioning liver and typically suggest initial hepatic steatosis. Now, what are the 11 late symptoms of fatty liver that you cannot ignore? First late symptom: dark urine. In hepatic steatosis, the urine darkens because the affected liver releases more bilirubin into the bloodstream. This bilirubin is filtered by the kidneys and excreted in the urine, increasing its concentration and giving it a darker color, similar to cola. Second late symptom: white nails. White nails, also known as laconicia, can be a sign of liver problems like cirrhosis or hepatitis. This change in nail coloration occurs due to changes in blood composition and circulation often associated with liver diseases. The liver's inability to process and eliminate toxins efficiently affects various systems, including the blood circulation under the nails, leading to pale or white nails. Third late symptom, red spots all over the body. When the liver fails to produce essential proteins for blood clotting, it can lead to a decrease in platelets known as thrombocytopenia and problems in the absorption of fat-soluble vitamins, including vitamin K. This deficiency is vital for clotting, and as a result, red spots may appear on the skin, signaling mesopatic problems. Fourth late symptom, spider veins. Hormonal imbalances caused by liver issues can lead to an increase in estrogen, which is not adequately processed. This excess estrogen causes the expansion of blood vessels, resulting in spider veins. This symptom indicates a problem with hormonal balance affecting blood circulation. Fifth late symptom, itching all over the body. In advanced liver disease, bile salts accumulate in the blood and deposit on the skin, causing intense itching. This itching is more common on the palms of the hands, but can spread all over the body, causing significant discomfort. Sixth late symptom, jaundice. Jaundice occurs due to the accumulation of bilirubin, a yellow pigment produced by the breakdown of red blood cells. Normally, the liver processes bilirubin, but if there is liver dysfunction, biliary obstruction, or an increase in the destruction of red blood cells, bilirubin accumulates, tinting the skin and eyes yellow. Seventh late symptom, pulmonary erythema. Pulmonary erythema occurs due to the dilation of blood vessels in the palms of the hands. This characteristic redness can reflect various conditions, including hormonal changes or liver problems like hepatic steatosis. Damaged liver function leads to a hormonal imbalance causing blood vessel dilation. Eighth late symptom, pale stools. In hepatic steatosis, the liver doesn't properly process bile salts, which are essential for stool coloration. As a result, stools become paler, reflecting the liver's difficulty in performing its normal functions. Ninth late symptom, night blindness. Night blindness, or nyctalopia, can occur due to poor absorption of vitamin A, essential for eye health. The liver plays a crucial role in storing and metabolizing vitamin A. Liver disease compromises this ability, leading to a deficiency that affects vision in low light conditions. 10th late symptom, gynecomastia. Gynecomastia, characterized by the enlargement of breast tissue in men, can be an indirect consequence of hepatic steatosis. The accumulation of fat in the liver interferes with the hormonal balance between estrogen and testosterone, leading to the development of feminine characteristics such as gynecomastia. 11th late symptom, pain on the right side of the abdomen, near the ribs. This discomfort is felt in the upper right quadrant where the liver is located. The liver's increased size can press on the phrenic nerve, causing pain around the right shoulder as well. This pain reflects the liver's enlarged state and underlying issues. That's why it's crucial to recognize the symptoms and address them promptly, even if you don't have any symptoms but possess risk factors for hepatic steatosis. How can you determine if you have fatty liver? Early detection of hepatic steatosis allows for complete reversal, safeguarding the liver from damage. Even when scars and fibrosis are present, progression to more severe issues like cirrhosis and liver cancer can be prevented. Diagnosis typically involves imaging tests such as ultrasound, CT scan, or MRI. While it's normal for the liver to contain a small amount of fat, exceeding 5% of its weight prompts noticeable changes in the images, indicating excessive fat accumulation in the liver. There are 3 degrees of hepatic steatosis. Grade 1, mild steatosis. Grade 2, moderate steatosis. And Grade 3, characterized by a large accumulation of fat in the liver. Who is more likely to develop fatty liver and what are the risk factors? First risk factor, obesity. Obesity significantly increases the risk of hepatic steatosis, where excess fat accumulates in the liver. This excessive fat impairs liver functions and causes inflammation. Over time, this inflammation can worsen, leading to scarring of the organ. This scarring is worrisome as it can progress to more serious conditions, including hepatic cirrhosis, severely compromising liver health and its essential functions. Second risk factor, type 2 diabetes. Individuals with type 2 diabetes face a higher risk of developing hepatic steatosis, a condition linked to insulin resistance, a central aspect of this disease. This resistance results in an abnormal accumulation of fat in the liver, negatively affecting its functions. This situation can progress to liver inflammation, increasing the possibility of more severe liver damage. Third risk factor, high blood pressure. People with high blood pressure have a higher risk of developing hepatic steatosis. As hypertension can contribute to the accumulation of fat in the liver, high blood pressure often coexists with other risk factors like obesity and insulin resistance, which together exacerbate the possibility of liver damage. Fourth risk factor, excessive alcohol consumption. Excessive alcohol consumption significantly increases the risk of hepatic steatosis. Alcohol is metabolized in the liver, causing oxidative stress and inflammation. This process leads to the accumulation of fat in liver cells, impairing their functions and potentially evolving into more severe conditions, such as cirrhosis and liver failure. Fifth risk factor, sedentarism. Sedentarism increases the risk of hepatic steatosis, as a lack of physical activity contributes to the accumulation of fat in the body and liver. Physical inactivity is also associated with other risk factors like obesity and insulin resistance, exacerbating the likelihood of liver damage. Other causes include the use of medications like amiodarone, diltiazem, tamoxifen, and corticosteroids. What can be done to reverse the fat in your liver? Essential steps to reverse fatty liver disease. First, exercise regularly. Currently, fatty liver has become a common problem in children, partly due to lifestyle changes. In the past, children remained active despite an inadequate diet, engaging in activities like riding bicycles. Today, the preference for electronic games has replaced actual physical activities. To combat this, it's recommended to engage in walks or other moderate activities for at least 150 minutes per week. Second, lose weight. By losing 5% of your weight, you can achieve significant benefits for your liver health, including reducing inflammation, fibrosis reduction, and decreasing hepatic fat, thus improving your overall health. Third, avoid alcohol. Reducing or avoiding alcohol consumption is essential to protect the liver. Alcohol damages liver cells, known as hepatocytes, and can lead to the accumulation of fat in the organ, compromising its function and health. Fourth, maintain a healthy diet. The health of our liver is closely linked to our diet. Often, an inadequate diet leads to fat accumulation in this organ. Fortunately, a balanced diet can be the key to reversing this condition. What are the 5 most toxic foods for your liver that you should avoid at all costs if you have fatty liver? First, ultra-processed foods. These include packaged foods and fast foods, which are detrimental to liver health. Avoiding ultra-processed foods is crucial to prevent fatty liver, as they contain high levels of sugars, saturated fats, and additives that increase the risk of hepatic steatosis. Second, refined wheat. Foods such as bread, pasta, and crackers increase fat in the liver. Avoiding refined wheat helps prevent fatty liver, as it can rapidly elevate blood sugar levels, contributing to insulin resistance and the accumulation of liver fat. Third, foods containing fructose. It's important to clarify that fresh fruits are not included. The biggest villain of all, causing the most fatty liver, is corn syrup and fructose, found in sodas, cereal bars, box juices, tomato sauce, ketchup, mustard, and jellies. Fourth, sugar. To maintain liver health, it's essential to reduce sugar consumption, including fructose. Sugar significantly contributes to fat accumulation in the liver, raising the risk of developing hepatic steatosis, a condition that negatively affects liver function. Fifth, vegetable oils. Today's diet is rich in omega-6, which causes inflammation, and poor in omega-3, which reduces inflammation. It's advisable to avoid vegetable oils, as many are rich in omega-6 fats, which in excess can promote inflammation and contribute to the accumulation of fat in the liver. And now, the 6 foods you should include in your diet to cleanse the fatty liver. First, turmeric. Turmeric, known for its anti-inflammatory properties, should be consumed with a pinch of black pepper to enhance its absorption and effectiveness in our body. Second, whole grains. Whole grains such as oat bran, flaxseed, and chia are rich in fiber and omega-3 and are associated with a reduced risk of hepatic steatosis. Third, coffee. Coffee containing caffeine, tocopherol, vitamin E, and chlorogenic acid acts as an antioxidant, reducing liver inflammation and offering protection against liver fibrosis. Fourth, olive oil. Consuming 3 to 4 tablespoons of olive oil daily can significantly reduce fat accumulation in the liver, promoting an improvement in liver health. Fifth, fruits. Research indicates that fruits, especially avocado, are effective in reducing liver fat. Avocado stands out due to its high content of glutathione, a powerful antioxidant that fights fat in the liver and promotes broader liver health. Sixth, cruciferous vegetables. Cruciferous vegetables like broccoli, Brussels sprouts, and cauliflower contain sulforaphane, which helps reduce liver inflammation and cancer risk, thanks to its sulfur derivative. If you have fatty liver, follow these guidelines. Thank you for watching. Don't forget to subscribe to the channel. See you in the next video. Did you know that eating just 2 cloves every day can be really good for you? Yes, it's true. In this video, we'll talk about the awesome things that can happen to your body when you have 2 cloves daily. So, get ready to learn some cool stuff about these tiny power-packed spices. Before we jump into the video, a quick reminder. This video is just for education purposes. If you have any medical conditions or health worries, always talk to your doctor before trying out these tips. Now, let's dive in. 1. Boosts immune system. Cloves are not just a spice. They are a powerhouse of nutrition, particularly rich in vitamin C. This essential vitamin is a keystone for a strong immune system. When we consume vitamin C, it aids our body in producing a higher count of white blood cells. These cells are our body's primary defense mechanism, always on the front line, battling infections and diseases. In a world filled with countless pathogens and environmental challenges, having a strong immune response is crucial. By simply incorporating 2 cloves into our daily diet, we can provide our body with the necessary tools to fend off illnesses. It's like giving our body the protection it needs to face the daily challenges thrown at it. 2. Enhances oral health. Oral health is often a reflection of our overall well-being. Cloves, with their inherent antiseptic properties, play a pivotal role in maintaining a healthy mouth. These properties actively fight against the harmful bacteria that can reside in our oral cavity, ensuring our gums and teeth remain healthy. But the benefits of cloves don't stop there. Anyone who toothache knows how debilitating it can be. Cloves offer a natural remedy to this pain, providing relief when applied directly to the affected area. Additionally, bad breath can be a source of embarrassment for many. Consuming cloves can combat this issue, acting as a natural breath freshener. In essence, cloves offer a three-pronged approach to oral health: fighting bacteria, reducing pain, and ensuring fresh breath. 3. Aids digestion. Digestive health is the cornerstone of our overall well-being. A smoothly functioning digestive system ensures that our body absorbs all the essential nutrients from the food we consume. Cloves play a significant role in enhancing this process. These tiny powerhouses aid in the production of digestive enzymes, which are crucial for breaking down food efficiently. When our body can break down and assimilate food effectively, issues like bloating, gas, and indigestion become less frequent. For many, digestive discomfort can be a recurring challenge affecting daily life. By incorporating cloves into our diet, we provide our digestive system with the support it needs to function optimally. It's like giving our internal machinery the right kind of oil to run smoothly, ensuring we feel our best from the inside out. 4. Anti-inflammatory. Inflammation, when chronic, can be the root cause of numerous health issues, ranging from joint pain to more severe conditions like heart disease. Cloves, with their potent anti-inflammatory properties, can be a natural solution to combat internal swelling. By reducing inflammation, cloves not only ease immediate discomfort, but also lower the risk of chronic diseases linked to prolonged inflammatory responses. Imagine a natural ingredient that acts as a soothing agent for our body, calming inflamed areas and promoting overall health. That's precisely what cloves offer. By consuming just 2 cloves a day, we can equip our body with a natural defense mechanism against the harmful effects of inflammation, ensuring a healthier and more comfortable life. 5. Rich in antioxidants. Our bodies are constantly exposed to external aggressors, be it pollution, UV rays, or the stresses of daily life. These factors can produce harmful molecules called free radicals, which can damage our cells and contribute to aging and diseases. Antioxidants are our body's superheroes, fighting off these free radicals and preventing potential damage. Cloves are a treasure trove of antioxidants. By consuming cloves, we're essentially fortifying our body's defense mechanism against these external threats. Think of it as building a protective shield around ourselves, safeguarding our health from the daily challenges we face. With just 2 cloves a day, we can significantly boost our antioxidant intake, promoting overall health and well-being. Bone health. Our skeletal system is the framework that supports our body, and maintaining its health is of great importance. Cloves come into play here with their rich content of essential nutrients, particularly manganese. Manganese plays a crucial role in bone formation and mineral density. As we age, our bones can become more fragile, leading to conditions like osteoporosis. By incorporating cloves into our diet, we provide our bones with the necessary nutrients to remain strong and healthy. It's akin to ensuring the foundation of a building is robust, allowing the structure to stand tall and withstand external pressures. With the daily intake of 2 cloves, we're not just nurturing our present health, but also investing in our future well-being, ensuring our bones remain sturdy as we age. 7. Blood sugar regulation. In today's age, with changing lifestyles and dietary habits, maintaining stable blood sugar levels has become a concern for many. Fluctuating blood sugar can lead to a host of health issues, including fatigue, blurred vision, and, in severe cases, diabetes. Cloves emerge as a natural ally in this battle. They possess properties that can aid in regulating blood sugar levels. For those who are constantly monitoring their glucose levels, either due to health concerns or as a preventive measure, incorporating cloves can be beneficial. Think of cloves as a balancing agent, helping to stabilize the sugar levels in our bloodstream. By consuming just 2 cloves daily, we can assist our body in maintaining this delicate balance, ensuring we remain energetic and healthy. 8. Liver protection. The liver is one of our body's most vital organs, playing a central role in detoxifying our system and processing nutrients. Given its significance, protecting it from potential harm is crucial. Cloves come to the rescue with their rich antioxidant content. These antioxidants combat the harmful effects of free radicals, which can damage our organs, especially the liver. By consuming cloves, we're essentially providing our liver with an added layer of protection, shielding it from potential threats. It's akin to giving a security system to one of our body's most essential assets, ensuring it functions optimally. With the daily intake of 2 cloves, we're not only promoting our liver's health, but also ensuring our overall well-being, given the liver's central role in our body's functioning. 9. Fights off bad bacteria. Our body is a complex ecosystem, home to both good and bad bacteria. While the good bacteria play a crucial role in processes like digestion, the harmful ones can lead to infections and diseases. Cloves, with their rich content of eugenol, act as a natural defense against these harmful bacteria. Eugenol has been recognized for its potent antibacterial properties. By consuming cloves, we're essentially fortifying our body's defense mechanism against bacterial threats. It's like having a natural antibiotic in our arsenal, ensuring a balanced and healthy internal environment. With just 2 cloves a day, we can significantly enhance our body's ability to ward off harmful bacteria, promoting a balanced gut and overall health. 10. Anti-cancer properties. Cancer is a word that evokes fear in many, given its widespread prevalence and potential severity. While research is ongoing, some studies suggest that cloves might possess properties that can combat certain types of cancer. These potential anti-cancer properties are attributed to the rich array of compounds present in cloves. By incorporating cloves into our diet, we might be providing our body with an added layer of protection against this formidable disease. Think of it as equipping ourselves with a potential shield against one of the most significant health challenges of our times. While cloves are not a definitive cure, their consumption can be a step in the right direction, offering hope and a proactive approach to our health. 11. Reduces stomach ulcers. Stomach ulcers, also known as gastric ulcers, are painful sores that form in the lining of the stomach. They can be caused by various factors, such as including excessive acid production, bacterial infections, and certain medications. Cloves have properties that can act both as a barrier and a healer for the stomach lining. Their consumption can reduce the risk of ulcers by promoting a healthy balance of stomach acids and protecting the stomach lining from potential irritants. Think of cloves as a protective blanket for the stomach, offering relief and promoting healing. By integrating just 2 cloves into our daily regimen, we can support our stomach's health, ensuring it remains resilient against the challenges it faces daily. 12. Fights respiratory infections. Respiratory issues, such as asthma or bronchitis, can be draining, affecting one's quality of life. The anti-inflammatory properties of cloves come to the forefront here, offering potential relief. By reducing inflammation in the respiratory tract, cloves can help reduce symptoms associated with these conditions. Moreover, their antibacterial properties can also aid in combating infections that often accompany respiratory issues. Imagine a natural ingredient that not only soothes the inflamed airways, but also fights off infections, ensuring we breathe easier. That's the dual benefit cloves offer. By consuming 2 cloves daily, we can support our respiratory health, ensuring we breathe freely and comfortably. 13. Natural painkiller. Pain, be it from a toothache, joint discomfort, or any other source, can be incredibly exhausting, affecting our daily activities and overall quality of life. Cloves have been traditionally used as a natural remedy for pain relief, especially in dental care. Their pain-relieving properties can offer relief from toothaches when applied directly to the affected area. Beyond dental pain, cloves can also be beneficial in alleviating other types of discomfort, acting as a natural alternative to over-the-counter painkillers. Imagine having a natural solution right in your kitchen that can offer relief without the potential side effects of synthetic drugs. By incorporating just 2 cloves into our daily routine, we can equip ourselves with a natural remedy, ensuring we remain comfortable and pain-free. 14. Improves skin health. Our skin is our body's largest organ and often a reflection of our internal health. Factors like pollution, stress, and poor diet can lead to skin issues such as acne, dullness, and premature aging. Cloves, with their rich antioxidant properties, can be a boon for skin health. These antioxidants combat the harmful effects of free radicals, leading to clearer and more radiant skin. Additionally, the antibacterial properties of cloves can help in reducing acne-causing bacteria, ensuring our skin remains blemish-free. Think of cloves as a natural elixir for the skin, promoting its health from the inside out. With the daily intake of 2 cloves, we can nurture our skin, ensuring it remains glowing and healthy. 15. Boosts testosterone. Testosterone is a vital hormone, playing a crucial role in various body functions, from muscle building to mood regulation. Some studies suggest that cloves can have a positive impact on testosterone levels. By boosting this hormone, cloves can potentially enhance various physiological processes, ensuring our body functions optimally. It's like giving our body a natural boost, ensuring we remain energetic, healthy, and in good spirits. As we conclude our discussion on the multitude benefits of cloves, it's essential to remember that while natural remedies can offer numerous advantages, they're not suitable for everyone. Cloves, despite their many health benefits, might not be the best choice for certain individuals. Pregnant and breastfeeding women, individuals on blood-thinning medications, and those scheduled for surgery should exercise caution. Cloves can act as a natural blood thinner, which might interfere with certain medications or conditions. Additionally, if consumed in excessive amounts, cloves can cause digestive issues and allergic reactions in some individuals. This video is intended for educational purposes only. It's crucial to remember that individual health needs vary, and what works for one person might not work for another. Before making any significant changes to your diet or health regimen, especially introducing cloves or any other natural remedy, Always consult with a healthcare professional or nutritionist to ensure it's the right choice for you. Your health and well-being are paramount. Stay informed, stay safe, and always prioritize your unique health needs. Did you know that skipping a healthy breakfast can increase your risk of stroke by up to 27%? It's true. Your breakfast choices could be silently impacting your health in ways you never imagined. Breakfast is often called the most important meal of the day, but not all breakfast choices are created equal. Some can increase your risk of stroke and other serious health problems like heart disease, high blood pressure, or diabetes, and unhealthy cholesterol levels. In this video, we'll uncover 10 breakfasts that skyrocket stroke risk to avoid. We'll dive into the details of how these common breakfast foods can harm your health. More importantly, you'll learn which foods to avoid and discover healthier alternatives that can help protect your heart and overall well-being. Before we dive in, can you do us a favor? Help us spread this life-saving message by hitting the thumbs up. If you're new here, don't forget to subscribe to Combat Heart Disease and click the bell icon so you never miss our new videos, and stick around to find out how to get 2 free heart health gifts. We guarantee both you and your heart will love them. Let's get started. Number 10. Sugary cereals. Starting your day with a bowl of sugary cereal might seem like a quick and easy breakfast choice, but it's one that can have serious consequences for your health. Sugary cereals are often packed with added sugars, which can lead to rapid spikes in your blood sugar levels, followed by crashes that leave you feeling tired and hungry soon after. This roller coaster effect not only saps your energy but also increases your risk of weight gain, obesity, and diabetes, conditions closely linked to stroke risk. Moreover, sugary cereals typically lack essential nutrients and fiber, making them empty-calorie foods that fail to provide the sustained energy your body needs to function optimally throughout the day. Instead of these unhealthy options, consider choosing whole grain cereals that are low in added sugars and rich in fiber. Whole grains help stabilize blood sugar levels and support heart health. Enhance your breakfast by adding fresh fruits, nuts, or seeds to your cereal. These additions boost the nutritional value of your meal, providing vitamins, minerals, healthy fats, and antioxidants. Up next, we'll discuss a popular breakfast item that might seem savory and satisfying but carries hidden dangers for your heart health. Number 9. Processed meats. Processed meats like bacon, sausages, and ham might be your go-to breakfast staples, but they pose significant health risks that shouldn't be overlooked. These meats are often high in saturated fats and sodium, both of which can negatively impact heart health. Excessive consumption of saturated fats can lead to elevated cholesterol levels and the formation of arterial plaque, which increases the risk of strokes and other cardiovascular diseases. Additionally, processed meats are frequently loaded with preservatives and additives that can be harmful over time. These substances not only contribute to inflammation, but also have potential links to cancer and other chronic health conditions. To reduce your stroke risk and improve your heart health, consider opting for leaner protein sources. Eggs, turkey bacon, or chicken sausage are excellent alternatives that provide the necessary protein without the high levels of unhealthy fats and sodium found in processed meats. Making these simple swaps can have a profound impact on your long-term health and well-being. Coming up, we'll reveal a breakfast favorite that's often mistaken for a healthy choice, but can secretly sabotage your efforts to maintain a heart-healthy diet. Number 8. Pastries. Pastries like croissants, danishes, and cinnamon rolls are undeniably tempting treats, but they may not be the healthiest choice for breakfast. These delicious pastries are typically made with white flour, a refined ingredient that lacks the essential fiber and nutrients found in whole grains. A study published in the Journal of the American Medical Association found that diets high in refined grains are linked to a 27% increase in the risk of major cardiovascular events, including stroke. Furthermore, pastries often contain significant amounts of trans fats, which are unhealthy fats that can elevate the risk of heart disease and stroke. Trans fats increase LDL or bad cholesterol levels while decreasing HDL or good cholesterol levels, leading to the buildup of plaque in arterial walls. For a healthier breakfast, consider choosing whole grain alternatives such as whole wheat toast or whole grain muffins. These options have higher fiber content and a richer nutrient profile. Compared to traditional pastries, helping to maintain steady energy levels and support heart health. Next, we'll discuss a seemingly simple breakfast item that can cause dramatic blood sugar spikes and crashes. Stay tuned to find out what it is. Number 7. White toast. White toast may be a popular breakfast choice, but it's not the healthiest option when it comes to stroke prevention. White bread has a high glycemic index, meaning it can cause a rapid increase in blood sugar levels. This leads to insulin spikes and subsequent crashes, leaving you feeling tired and hungry shortly after eating. Moreover, white bread is made from refined and processed flour, which lacks the fiber and nutrients found in whole grains. To reduce your stroke risk, choose whole grain bread for your breakfast toast and pair it with protein-rich toppings like avocado or nut butter for a balanced meal that supports heart health and keeps you energized throughout the day. Coming up, we'll reveal a popular breakfast item that can actually pack a hidden punch of unhealthy fats. Don't miss it. Number 6. Pancakes. While pancakes are a beloved breakfast staple, they might not be the best choice for stroke prevention. Traditional pancakes are typically made with white flour, which lacks the fiber and essential nutrients present in whole grains. This can lead to rapid spikes in blood sugar levels, followed by crashes, leaving you feeling fatigued and hungry. Moreover, pancakes are often drenched in syrup, which is high in added sugars. This combination of high-sugar pancakes and syrup can contribute to weight gain and elevate the risk of developing chronic conditions like obesity and diabetes. To reduce your risk of stroke, consider opting for whole grain pancakes or trying alternatives like oatmeal pancakes made with whole oats. These options provide more fiber and nutrients, helping to stabilize blood sugar levels. Additionally, choose nutritious toppings such as fresh fruits or small amounts of natural sweeteners like honey or maple syrup to enhance the flavor without compromising your health goals. As we reach the midway point, it's crucial to understand that many breakfast foods are not as healthy as they appear. Deceptive marketing and overlooked dangers can put your health at risk. For example, cereals labeled as whole grain often contain high amounts of added sugars. According to the Environmental Working Group, over half of children's cereals have more sugar per serving than a Twinkie. Similarly, processed meats marketed as natural can still be loaded with harmful preservatives like nitrates and excessive sodium, contributing to heart disease and stroke. The Center for Science in the Public Interest has highlighted these misleading claims. To protect yourself, always read ingredient lists and nutritional information. Coming up, we'll reveal a breakfast favorite that might seem healthy but contains hidden unhealthy fats. Stay tuned. Number 5. Fast food. Fast food breakfast options may be convenient, but they are often high in unhealthy fats, sodium, and calories. These foods can significantly increase your risk of developing chronic conditions like high blood pressure, heart disease, and stroke. In addition to being high in saturated fats and sodium, fast food breakfast items often lack essential nutrients like fiber, vitamins, and minerals. These nutrient deficiencies can lead to long-term health issues, including weakened immune function and poor overall health. By incorporating lean proteins, whole grains, fruits, and vegetables into your breakfast routine, you can provide your body with the necessary nutrients to support energy levels, cognitive function, and overall well-being. Preparing nutritious breakfast options at home allows you to control the ingredients and portion sizes, setting a positive tone for the rest of your day. Coming up, we'll discuss a breakfast food that might seem healthy but can actually sabotage your efforts to maintain a heart-healthy diet. Don't miss it. Number 4. Flavored yogurts. Flavored yogurts are a popular breakfast choice, but they often come with a hidden downside: added sugars. Many flavored yogurts contain more sugar than a candy bar, leading to rapid blood sugar spikes and subsequent crashes. This can leave you feeling tired and hungry, rather than energized and satisfied. Despite being rich in protein and calcium, the high sugar content makes these yogurts more of a treat than a healthy breakfast option. To make your yogurt a more nutritious choice, opt for plain Greek yogurt and add natural sweeteners like fresh fruits or a drizzle of honey or maple syrup. This way, you can control the sugar content while enjoying a wholesome and fulfilling meal. By making this simple swap, you can reduce the risk of strokes associated with high sugar intake and start your day on a healthier note. Next, we'll explore a breakfast option that seems healthy, but can pack a surprising amount of hidden sugars. Number 3. Smoothies. Smoothies are often seen as a convenient and healthy breakfast choice, but it's essential to be mindful of their sugar content and nutritional value. Many store-bought or fast food smoothies are loaded with sugars from fruit juices, ice cream, or sweetened yogurt, making them less healthy than they appear. Creating your own smoothies at home allows you to control the ingredients and ensure a healthier alternative. To increase protein content, include Greek yogurt, tofu, or protein powder, which supports muscle recovery and keeps you full. Healthy fats from avocado, nuts, or nut butter can further enhance nutrient absorption and maintain satiety until your next meal. Sweeten your smoothie naturally with honey or dates to keep blood sugar levels balanced. By following these tips and making your own smoothies at home, you can enjoy a delicious and nutrient-dense breakfast that supports overall health and well-being. Coming up, we'll reveal a breakfast staple that might seem harmless, but can actually lead to serious health issues. Don't miss it. Number 2. Fried foods. Fried foods are a popular breakfast choice, but they can be one of the worst options for stroke prevention. Cooking methods that involve frying, especially in vegetable oils, produce harmful compounds like trans fats and advanced glycation end products, which contribute to inflammation in the body. Regular consumption of fried foods leads to weight gain, inflammation, and chronic conditions such as heart disease and stroke. The unhealthy fats in fried foods elevate cholesterol levels and promote the buildup of arterial plaque, significantly increasing the risk of cardiovascular issues. To reduce your stroke risk, choose healthier cooking techniques like baking, grilling, or steaming. These methods help retain the nutritional integrity of the food without adding excessive, unhealthy fats. Before we unveil our number 1 food to avoid, let's pause for anticipation. To support you in fighting heart disease more effectively, we're thrilled to offer 2 extraordinary free gifts we've compiled just for you. First up, we're giving away our exclusive ebook, 7 Foods That Clean Arteries and Prevent Heart Attacks. This is no ordinary list. It's a treasure trove of culinary delights that are both mouth-watering and beneficial for maintaining stable blood pressure levels. And lastly, you'll gain access to a breakthrough video, the shocking cause of cardiovascular disease and what you should do starting today. This innovative approach, the ancient signaling molecule found in our ancestors, offers a potential paradigm shift in how the nectar of gods can help restore it for optimal heart health. It's a piece of knowledge too valuable to miss. To claim these incredible 3 free gifts, simply click on the link in the description below. Let's return to our countdown and unveil the number 1 food to avoid that stands as a pillar in the 10 breakfasts that skyrocket stroke risk. 1. Coffee. Coffee is a beloved morning beverage for many, but certain coffee drinks could potentially increase your risk of stroke. Specialty coffee beverages such as mochas, fraps, or caramel macchiatos are often packed with added sugars and unhealthy fats. According to a study published in the journal Circulation, high consumption of sugary drinks, including certain coffee beverages, is associated with a 30% increased risk of developing cardiovascular disease. Excessive consumption of added sugars can lead to weight gain, high blood pressure, and an elevated risk of chronic conditions like heart disease and stroke. Additionally, some coffee concoctions are topped with whipped cream or flavored creamers, further boosting their calorie and fat content. These ingredients can significantly raise your intake of unhealthy fats, contributing to arterial plaque buildup and increased stroke risk. To mitigate your stroke risk, consider opting for healthier coffee alternatives such as black coffee or coffee with a modest amount of milk or unsweetened plant-based milk. If you enjoy flavored coffee, try incorporating natural flavor enhancers like cinnamon or vanilla extract. These simple adjustments can promote a healthier breakfast routine and help lower your chances of experiencing a stroke. So there you have it. 10 breakfast foods that can skyrocket your stroke risk. Being mindful of your breakfast choices can significantly impact your health. Understanding how certain foods affect cholesterol and blood pressure levels is key in stroke prevention. Take charge of your health by adopting healthier breakfast habits. Now, we'd love to hear from you. Which of these foods surprised you the most? Share your thoughts in the comments below. If this video has helped you rethink your breakfast choices or reinforced your current health strategies, please show your support by hitting the like button, subscribing to combat heart disease, and clicking the notification bell so you never miss our new videos. For those considering showing extra support, the Super Thanks feature is a great way to help us continue providing valuable health insights. Before you go, check out the 2 exclusive free gift links in the description below. They're packed with tips and resources to keep your heart healthy. Remember, your health is in your hands. Thank you for watching. Stay vigilant, stay informed, and here's to your